So dry eye therapies, there's tons of options out there. Light-based therapies like IPL and low-level light therapy. The key to these therapies, they target inflammation. They target abnormal blood vessels that are causing your glands not to function well. You're not producing enough tears, you're not producing enough oil. There's heat-based therapies like Tixel and radiofrequency. These heat-based therapies are there to make sure that your glands secrete oil versus like a toothpaste or margarine type substance. We want it to be oil based so it goes on top of the tears and stops evaporation. There's regenerative medicine, amniotic membranes, autologous serum. This is where you use your own body's tissues to heal your eyes. And then, as you know, tons of pharmaceutical options exist in terms of nasal sprays, drops that work in different mechanisms of action to get you to have the best possible tear film. So if you're suffering from dry eye, make sure you go to an office that has more than one treatment option. You want to find the best combination for your specific situation. If you're just getting a heat-based option or a light-based option, they may be effective, but they won't be optimal. The goal at our office is to have all the options so we can cater the plans to your specific needs and give you the best possible outcome. Like and subscribe for more tips.